Good morning, everybody. I am Cheryl Isabel, the Milwaukee Community Engagement Lead for covering Wisconsin. And today we're just going to talk a little bit about, oops, I'm having some problems here, Zoom and unexpectedly. We're going to talk a little bit about, can everybody see my screen?
I can. Yep.
Okay, great. We're just going to go over and review covering Wisconsin, who we are, what we do.
Oh, Cheryl, I think we lost your screen and you went on mute. Something happened. No worries, folks. Just give us a minute. We'll figure out what happened.
Can you hear me now?
Can hear you. Can't see
Okay.
the screen. You might have to reshare.
Alrighty then.
That's just Monday morning stuff.
Can you see my screen now?
And not.
Can you see it now?
No. If we have to, I can try sharing the presentation and I can click through. It's a little bit of a change up from what we were planning, but that's okay.
Yeah, let's go ahead and do that. I want to be respectful of everybody's time.
Yeah, 100%. Let's see here. All right. Can people see my screen? Yes? Good. Then I will go ahead and move this so I can do a slideshow. All right. It did say I got that error message too as well, Cheryl.
It's lost?
No, I think we're okay.
Okay. Because I did receive a couple of error messages. And again, thank you everyone for your patience with these technical glitches this cool, bright, but crisp Monday morning.
All right. So we are still recording. And if you can see that, then we should be good to go, Cheryl.
I can't see a thing, but no worries. I can see it. I've got my slides up on my end.
Okay, we'll manage.
Okay. All right. So again, we're going to talk a little bit about Wisconsin and what we do and what Medicaid members need to know. And then we're going to talk about transitioning to other forms of coverage should members become ineligible for their Medicaid benefits. And then go through some tools and referrals for you guys to be able to use and connect with Covering Wisconsin and other enrollment sisters in organizations to help your clients get through this process. Well, Covering Wisconsin, we are the state's navigating entity for the helping people find and keep their health insurance. We are a program of UW Extension that help people in Wisconsin find that health insurance. We are a navigating agency since about 2014, and our expert health insurance navigators are licensed both federally and statewide to help folks through navigating the insurance coverages and understanding what help they can get and just overall just understanding the entire process. At Covering Wisconsin, we create consumer tested materials, and we offer training for professionals such as yourself and our partners on health insurance topics. Now, the Covering Wisconsin Health Insurance Navigators, you all heard this word navigators, but what our health insurance navigators do is we provide free help anytime, whether it's big or small, consumers understanding all of the health insurance questions they might have, and we help them find plans to provide them financial help. They can sign up through healthcare.gov Marketplace, Badger Care Plus, or any Medicaid program. We also get them help with their billing coverage problems and find community programs to help them pay for insurance and or Medicare. Now, we provide this assistance for consumers and professionals across the entire state of Wisconsin. We cover all 72 counties. Covering Wisconsin, as an organization, we have 21 navigators on staff, but we can't do all this work alone. So we have subcontracting agencies around the state, and that gives us about 45 navigators located in different areas of the state that are able to assist consumers in navigating their health insurance coverages. And they provide these services by phone, Zoom, or we can even meet the consumer in person. Now, we also have the different types of enrollment assisters. And again, as I mentioned before, we're all licensed at both federal and statewide. And we're navigators. Some are considered certified application counselors and or agents and brokers. There are many agencies around the state who have assisters on staff. Now, those certified application counselors that I'm speaking of, you'll find those persons that can help assist you and your consumers in places like community-based organizations, hospital systems, our federally qualified health centers. But all of this help that are provided by enrollment assisters is always free. Now, we're going to dive deep into why we're all here today and understanding this Medicaid unwind, redetermination, or renewal. It's been coined a lot of different words that have made it quite confusing for consumers and people such as ourselves to understand what the heck is going on. And so we're going to talk about that. What is the unwinding? And what the unwinding is, simplified, it's just a process of moving from the continuous eligibility to a pre-pandemic routine of renewals and eligibility policies. Now, we all know that over the past 3 years, at the beginning of the pandemic in March of 2020, the federal government deemed that all consumers in every state that had Medicaid or any of its products would resume throughout the pandemic their health insurance coverages through the state. Now, with this unwinding process, it ended in December of 2022. That meant that all states, including Wisconsin, had to go back and start processing consumers with benefits for Medicaid as they normally did, which was on an annual basis. So before the pandemic, every 12 months, our consumers had to renew their health insurance coverage portion of their statewide benefits. Now we're moving back to that. But what we want to make sure is that this process is successful for everyone that does have Medicaid. So our unwinding goals in Wisconsin includes implementing a successful return to that routine operation, such as renewals. Like, we want to make it easier, but the whole goal is to help Wisconsinites stay covered. We want people to be able to continue their eligibility as long as they're within that income guideline that's required by the state. And if they're no longer eligible for those state programs, we want to help them understand why they're not eligible any longer. And if they perhaps now have jobs that have employer-based insurance, we want to help them transition into that employer-based coverage or plan for a healthcare.gov marketplace insurance program so that there are no gaps in their coverage and they can have continuation of seeing their doctors, getting their prescriptions covered, and all of their medical services met. Now, the Badge Care Plus Medicaid changes. Again, the renewal deadlines for the state of Wisconsin are going to be spread out over 12 months. It began in June of 2023, and it will go all the way through May of 2024. Now, we're about 4 months into that process right now, so people have begun to get their renewal notifications and had to start acting on renewing their medical coverage with the state. And people can find their coverage renewal month by creating an account on accesswisconsin.gov or the My Access app. That's an app that can be uploaded on their smartphones. But we want to keep in mind, and we want to make sure that people are not renewing too soon, because this can cause them to lose their insurance unnecessarily or sooner than it needs to happen. So the state is rolling out monthly a bunch of letters to consumers telling them when their renewal date month is. So we are encouraging, and we're asking you to encourage those clients and consumers that you serve to watch for that mail. And if perhaps they have a date that's not coming up too soon, like for an example, if it's in November, we want them to renew in November. But if their date is not until January, February, March, or May of 2024, we don't want them to react too early, because we don't want them to lose that coverage earlier than necessary. They should be renewing within that renewal month. So those action steps that we want them to take, again, check the renewal date and wait. And the consumers can download that My Access app and sign in. This is the easiest way. All they'll need is their case number, if they have a Forward Health card number, and if they have Food Share, that Quest card number. That will help them be able to sign up on the My Access app. On that app, they can also get push notifications. So if their renewal date is a little further out, that push notification will remind them or send them a notification of, yeah, hey, it's time for you to start that process, or it's getting close for you to start that process, depending on whatever that date is. They can also keep their contact information up to date, change it if perhaps they've moved, change their email address, change their phone numbers. They can change that information on that app at any time, and it's seen in real time by the agencies that are serving those folks. And they can check their renewal month. Now, what we're asking folks to do, and if you have clients, what we want them to do is when they get their notification of when their renewal month is, that they should start that process within the first of that month of that renewal date, no later than the 15th, because we want to give our consortium agencies time to process those necessary documents that will be asked for, like proof of residency. If they're working, they'll want to see 30 days of pay stubs, or they might want to see an employee's employment verification form, things like that, that the agencies will need to completely process that renewal of their healthcare coverages. Just some pictorials, because we're all visual persons, I know that I am, of where a consumer, your client, can find that renewal month in access. And I just want to be mindful to remind you that a consumer can only renew either online on accesswisconsin.gov or through the mail when they get their renewal packet, or they can call into the consortia and renew that way. But when they're online and when they go to their account, they will see, this is exactly what that screen is going to look like. They will see further to the left, a Renew My Benefits month. And when they click on that, it's going to tell them all the things that they need to know, or they're going to see as an overview when they go through this renewal process. And it'll also tell them at the very bottom of the page when that date is and if they should act. And they're going to see a screen such as this: when to renew. Renew the benefits now. It's going to tell you when to renew those benefits for healthcare. And it's going to designate healthcare. Some cases, if the client has food share, they'll have a food share date and they'll have a benefits date for healthcare. But it will note when that is supposed to happen. If their date is further out, there's a flag there as well. Don't renew, renew later. And to submit the renewal by the Take Action Renew By date to avoid any gaps in coverage. If they renew or send that information in too late in their renewal month window, there is a possibility that the agencies won't have time to completely process that renewal. So if that doesn't happen by that 31st day of that month, they may risk having a small gap in coverage. It'll catch up, but they will have a small gap in coverage. And we don't want that to happen, because say they have to go to the pharmacy and pick up a prescription, they won't be found eligible in the systems that pharmacists use. Therefore, they won't be able to pick up their prescription utilizing their Forward Health Card, or they will be in a position where they'll have to pay for that prescription until their application has been fully processed. Now, on the My Access app, we are encouraging people to, if they have a smartphone, to please, please, please upload this app for a couple of reasons. Consumers can check their renewal dates. They can update their contact information, get those reminders through those push notifications of when it's time to take action. It's an easy process. They'll take a picture of those verification documents that are required and upload them. And the agencies can actually see that these documents have been uploaded and start that process within 20 minutes of that upload. So it is the quickest way to get those documents in once you're going through that renewal process. So the My Access app has been available to consumers for about, I'm going to say about 4 years now, but we're going to just be pushing this more and more and more and helping consumers upload that app, because it is a quicker solution to getting those documents processed in a timely manner. And you can also help the consumers download this app if they're just not sure how to do it. You're going to go to the My Access app, and if they're signing on for the first time, again, all they'll need is their case number, their Forward Health ID card number, or the Quest card number. Once they've uploaded that app, you can help them find where to find that renewal date in the My Access app. Check their benefits. They're going to click on that. They're going to tap Badger Care Plus. And then they're going to look for that next renewal or act by date. And this is just a pictorial of what that looks like on the smartphone in that phone format. And again, just wait to renew until that renewal window. Most people are receiving letters now that we're in that fourth month of the renewal process that are going to be going into the end of the year early part, first quarter of 2024. DHS has created all types of modalities to try to help consumers through this process. And along with the My Access app, they've created online application for renewals for Medicaid members. And this is on a web page where they can also find their renewal information. And once they find that renewal information, they can go onto the DHS web page and check again their renewal date windows. And this is a very simplified way to try to help people stay on track of when to renew as well. It'll tell them when their renewal date is. It'll also let them know if they've missed that date. And it's happening, so we want to try to prevent that. But if they've missed that date, they do have 90 days. There's a 90-day window where they can still go in and renew and not have to start that application process all over again. But they have to react within that 90 days of when they were supposed to renew. It'll also show them their last chance to renew, and if the date again is further out, when they need to renew. And now I'm going to pass it over to my colleague, Adam. Adam, take it away.
Right. And thank you folks for putting up with some technical difficulties this morning. I know I got like 4 Zoom crash reports, so I'm surprised nobody was kicked out, which is great. I'm really pleased. Despite all that chaos, we are still trucking along here. And thank you, Cheryl, for doing that lovely introduction overview of the Medicaid unwinding. So apologies if there was any slight delay, disconnect on the transitioning of the slides there, because this was not quite as planned, but I think it's going all right. And I did see one question come in through the chat, at least. I just want to remind people to stop sharing. Remind people to go ahead and use the Q&A function to ask their questions. Although I will kind of take that one. I think it's a great question on what about blind participants, who helps them with their application. There's an entire category of Medicaid called EBD, Elderly Blind Disabled Medicaid. That covers a significant portion of Wisconsin's Medicaid eligible population. There are a number of resources available, and I know that the Access website, I'm not sure about the app, but the Access website has some accessibility features, and a lot of just computers in general will have things that will do, like, you know, reading of the screen aloud and things like that. But people can also always go to their IM agency office in person. So the main options, I feel like, for blind or members who are blind or have blindness as a disability are either going to be to call the IM consortium directly, or utilize some of those accessibility features, or if they can make it to the office in person, anybody can always renew their eligibility in person as well as an option. So that's a great question. We will do more Q&A at the end here, and I will talk now about transitioning to other forms of coverage, because we have a lot of people now who are no longer going to be eligible for Medicaid. Throughout the unwinding, people have had continuous eligibility. It's been incredibly helpful and valuable for folks throughout the pandemic to just be able to say, hey, I am I'm covered, and this is one fewer stress in my life. That said, the Robert Johnson Foundation and Urban Institute estimate, and this number fluctuates, but about 385,000 people who will lose Medicaid Badger Plus during this period. And these folks will need to transition to other health insurance coverage. There are some options, including employer-sponsored coverage, as Cheryl mentioned. So a lot of people who have gotten jobs with access to health coverage that haven't had to take that health coverage yet. So we'll talk a little bit about that. Healthcare.gov, which is Navigators. That's what we do. It's kind of our bread and butter, although we do help significantly with Medicaid as well. And Medicare is an option for people who are either eligible because of a disability or who are over 65 with enough qualifying quarters. I will say, and probably said this more than once, but Navigators, like covering Wisconsin, we do not do Medicare. So it's really important to note that Medicare is not what we do. We're specifically not certified or licensed for that. There are the Aging and Disability Resource Centers and agents and brokers out there who specialize in Medicare. We have an obligation to not give people bad information about Medicare. We just have enough information to educate and say kind of our limitations and let people know, okay, you might be eligible here. Here's somebody you should talk to. So everybody kind of has their lanes, and ours tends to be Medicaid and healthcare.gov. And then for people who can't get any of these other options, or for whatever reason fall through the cracks, there are always going to be federally qualified health centers and free clinics. Many of those in Milwaukee you may be familiar with already. 211 is a great resource that you may be aware of in Milwaukee. I believe it's Impact 211, where you can call, just have your consumers, or you could call that number and say, I want to find an enrollment assister. That is a great way to get a hold of a Covering Wisconsin or one of our subcontracted navigators, or a CAC through a different facility potentially. But you can call 211 or go to wiscovered.com and find an assister that way as well. And we'll talk a little bit more about those resources at the end. So healthcare.gov, big part of getting people enrolled in healthcare.gov. So this is the ACA, Obamacare, healthcare.gov, all talking about the same thing here. And that's, plans coverage covered through the Affordable Care Act. Big part of that, and a big part of what happens when people lose coverage, or in this case, lose coverage because of the unwinding, is a special enrollment period. And people have 60 days to qualify, typically for a normal special enrollment period, which for most of them, you'll see right in the middle here, tends to be about a loss of insurance. And in this case, throughout the unwinding is referring to a loss of insurance. However, we do have the special enrollment period throughout the unwinding that if anybody loses their Medicaid Badger Care Plus at any time between now and the end of the unwinding, so through July of next year, we can go ahead and get them covered through the marketplace. Assuming they're eligible and don't have other offers of insurance, we could go ahead and get them enrolled in the marketplace, and time is not a factor is the main thing. You can, this is not super easy. I mean, the process is fairly easy, but the rules and everything can be complicated for people. This isn't everybody's job. That's why navigators exist. Somebody looked at the Affordable Care Act and said, this is complicated. We should have experts out there who help people for free. That's what we do. And we can go ahead and help people get into the marketplace with the special enrollment period. And then this slide is just referring to that special enrollment period. So anybody who is losing coverage during this unwinding period between March and July of next year can go to healthcare.gov. They can attest the loss of coverage. They don't need to verify it. They just say, hey, I lost Medicaid. This is the date. They're not required to submit that letter saying they've lost it. And then they can do their application, and then they have 60 days to complete that application and select a plan. So that's really the only time factor. Is they have all the time they need in this time period to get in there, and then they have 60 days to choose new coverage. But ideally, and this goes for all time, not just the unwinding, if somebody knows they're going to lose coverage, so say that they know that renewal date that Cheryl was referring to, they look that up and they say, okay, I've renewed and I know I'm going to lose coverage at the end of the month. They want to act and get on healthcare.gov or get in touch with the navigator to get them on healthcare.gov before the last day of that Medicaid coverage, so they don't have a gap. So they don't, go uninsured for a month or two or anything like that. It does happen. It's not the end of the world, but the last thing you want, and we see this often, is consumers, that they don't find out they don't have coverage until they go to pick up their prescription. And we like to avoid that whenever we can to figure out find these people and get them in healthcare.gov or get them on other coverage so they don't experience that hardship. So Medicare, just again, that reminder that navigators are not Medicare experts. We do have fact sheets, and when we send out this presentation, you can access these links as well on how to contact your local Aging and Disability Resource Center or the Medigap helpline in the state. And you can get a special enrollment period similar to the marketplace, but for Medicare to get in. If you're eligible, you're going to be over 65 or have a disability and have, qualified through other means for Medicare. So you'll have these special enrollment periods for A and B and for the Medicare Advantage plans. Also, I would be remiss if I didn't mention that, we've got, Medicare open enrollment and marketplace open enrollment going on right now. And we could talk more about those as well. But the special enrollment period goes before, during, after. the open enrollment period. So if somebody is thinking, oh, I only need to worry about open enrollment, odds are with the unwinding, they'll still be able to get into the special enrollment period for any program. And that includes coverage from a job. So we mentioned population before, people who have started working, people whose jobs offer them insurance, and they haven't had to take that insurance because they've just been continuously eligible for Medicaid or Badger Care Plus. And that has been fantastic. That's coverage they didn't have to pay for. And now they may find themselves, okay, your coverage is ending. I need to take that insurance for my job now. People typically have, when they have a qualifying event, 30 days to get into their job-based coverage. However, under the HIPAA Act for the federal government, people have 60 days if they lose their Medicaid coverage to get into health insurance through a job. So that is something that people may have to point out to their employers, because it's not something that has been exercised at this scale ever. It's pretty unprecedented. But if people, lose their Medicaid, they have 60 days to get into their job-based coverage, so that is something to be aware of. And I will say this is a particularly important one. So we'll find out through the evaluations and hopefully maybe through Q&A, different populations you guys work with. But one of the big things is people who have access to job-based coverage, they're not going to be eligible for tax credits through the marketplace for other help. So this 60-day window is one of the most important ones we talked about, because I talked about special enrollment periods in the marketplace. You've got this whole unwinding to get in. We'll help you. We can make sure you get into the marketplace. But if you've got job-based coverage, you're not eligible for that financial help through the marketplace. We want to make sure you don't miss that window to get your job-based coverage. However, that said, if that coverage, and again, this is something navigators help people figure out all the time, is determined unaffordable for the entire family, we may have a situation where somebody can enroll in their job-based coverage themselves, and their family can go onto the marketplace because it's going to be more affordable. We all see that when we do our own insurance, is that the individual coverage looks really affordable, but then when you go to do the family coverage, it can be a lot more expensive. And there are now, thankfully, as of last year, protections in place to help people with that. And you'll see, we'll talk a little bit about our fact sheets. The affordability worksheet is just one of the resources and fact sheets we have available on our website. Tips for avoiding scams. I can't emphasize this enough. This is like scam season. I will say that scam season is all year in the United States. But right now, especially with open enrollment coming on and the Medicaid unwinding going on, there are a lot of bad actors out there looking to take advantage of people. They have all kinds of tactics they use. They send out letters. They do cold calls. They send suspicious emails. And consumers are really vulnerable to this because they often go, yes, I want help, I need help, and often the timing is just so suspicious, or just so like right on when, oh, I'm losing coverage, and they happen to get that email, they happen to get that letter at that right time where somebody's offering to help, and it looks like it's from a navigator, or it looks like it's from the state or something like that. So just want to train the people you work with, or get them in the mindset of help should always be free. It should always be unbiased. I'm always telling people, if something it doesn't feel right, just hang up. Just hang up. Call 211. Call Covering Wisconsin. Call usually a trusted resource, which might be you in your role, to help them verify that they're talking to the right person. Like typically, when it comes to insurance, inbound calls can be bad. We do some inbound calling, especially to consumers we've helped in the past, and they're kind of used to that. But a lot of what the scams they start as is these cold calls, or people will go to websites thinking they're doing everything right, and they want to sign themselves up for coverage. They want to make sure that they're not missing anything. So they'll go online and submit their information and immediately start getting bombarded with calls. And that's really suspicious. And sometimes they're operating within the bounds of the law, but really, really badly, right? Looking to just sign people up for whatever, get a commission, get brokerage fees, get monthly sign-up fees. They have all these different avenues they use to get people's money. So if nothing else, remind people, especially when they're going to be checking on their own, to look for that .gov. So we talked about access.wisconsin.gov, same thing, healthcare.gov. That's going to keep them operating on federal and state, sponsored pages, the actual applications themselves, and away from any of the scams. But just if nothing else, remind people to be cautious during this time. And we'll talk about some tools and referrals through Covering Wisconsin. So we have Covering Wisconsin, we have an Unwinding webpage, basically kind of restructured some of our existing pages to cover this unprecedented time with more resources around Badger Care Plus, updated all of our fact sheets about that. So if you go to coveringwi.org/free help, you'll see a lot of those resources, and you can navigate to cover some of the different things, or teach consumers to cover the things that we just talked about, like finding the renewal date, how to renew, submitting documents through My Access, etc. And then what if I don't qualify, like we just talked about. And then we do have a lot of educational resources, and I mean a lot of educational resources on our website through coveringwi.org/learn. We translate everything into Spanish, so everything is available in English and in Spanish. And we also consumer test every resource we have, which is really nice because we're able to, we'll do focus groups and we'll get that feedback, and we'll get language that works the best, or that we find works the best for groups of consumers, to make our products as understandable as possible. This is all free, obviously. You can access these, help consumers access these, or reach out to us if you're looking to get them in greater bulk, or to use them to some greater effect. But we have how-to sheets and then community resources as well, including things from Milwaukee, and everything is in English and in Spanish again. So these how-to sheets for consumers, this one in particular for the Unwinding, is the worried about losing your Badger Care Plus or Medicaid sheet. And this includes, again, a lot of what Cheryl went over, these pictorials, these step-by-step instructions for how to check renewal dates, contact info for experts like us, and really emphasize for people that sweet spot to renew, that when to renew that Cheryl was emphasizing. And then, of course, listing for people other options if they find out that they no longer qualify. Usually the answer, honestly, is just to get in touch with a navigator, get in touch with Covering Wisconsin, because you're going to get that best advice. But that's not to downplay the role that you all have. Anyone who's working with consumers or in a public-facing role has a chance to help people and help educate people through this process. So there's a lot of touches that we all have in the degrees of trust that we have with the community allow us to do a lot of good here. And it really, you don't have to be a navigator to point somebody in the right direction to help give somebody a good referral to get people the right information. Similar here, we have the how-to sheet on renewing in Badger Care and Access. And then same thing, that's step-by-step instructions and all that additional information on experts and what to do if you find you're not eligible. A public charge screening tool. This is one that we do like to remind people exists, although it has become less of a hot topic in the last, since the Unwinding really kicked off, or since the pandemic started to end, where people are worried about their status as a public charge. Typically, people who've immigrated to this country and have mixed status households and things like that. This is really to emphasize for people, that they have a lot of protections, and that their coverage is safe, and the coverage for their family members is safe. But we did this collaboration with the Wisconsin Collaboration on Immigrants and Public Benefits, and there's a lot of good resources here if you happen to work with immigrant populations, Spanish-speaking populations with immigrant members in the household. This is just a really good resource if that is kind of your area of focus. And then we also have screening resources on our site and through the Healthy Milwaukee, Healthy MKE Saver tool, where if somebody is looking at their coverage options for the first time, they can just put in some really basic information. Again, not any of their personal information, so they're avoiding tips and scams, but it'll give them an idea of what they might be eligible for based on their family size and income, which a lot of this comes down to family size and income. And then we build kind of the case and the consumer situation from there. There we go. We also have an outreach. Interesting. I did not know that there was an active video in this presentation. But yes, we do a lot of outreach. We do a lot of media and promotions in English and in Spanish. That is Lourdes, one of our navigators, who is fantastic. Um, but yeah, we have a toolkit covering wi.org/toolkit for English and Spanish resources. Again, depending on your role, these are things that you might publish, you might put out at your offices, you might distribute to consumers and partners other ways. But we do a lot, and we're always updating it, and we also take feedback from the community and partners as well. So this is these are basically, I feel like, updated every season if I had to put a timeline on it, just to make sure that we are as current and everything is as catchy and effective as it possibly can be. But if you want to utilize any of the stuff and you want to personalize it, you can always get in touch with us and collaborate with us that way. And then if you are social media folks, social media savvy or active on there, not only covering Wisconsin, but also Department of Health Services, Office of the Commissioner of Insurance, healthcare.gov puts out a lot. Social media is one of the most effective ways to reach consumers these days. And I know Healthy MKE and a lot of other Milwaukee groups do really great work in this arena as well. So if you are the kind of person who is active and interested in promoting kind of this public good and getting the right information out there, you can always follow us or any of these organizations, repost, share, etc., and spread the word. Enrollment networks is something I'd really like to highlight for folks, especially since I don't know how many folks on this call are familiar with the Milwaukee Enrollment Network, which is one that has been really active for a long time, MCAN. We have, through partnership with the state of Wisconsin, been able to reinvigorate the enrollment networks, the regional enrollment networks, or RENs, throughout the state. It's something that started a long time ago with the kind of implementation of the Affordable Care Act, but through different challenges, different regions, each region has had different levels of success, but a lot of it comes down to resources and funding. But these are really, really valuable collaborations between partners in different parts of the state. Again, that were originally created when healthcare.gov first opened, that first open enrollment period, that we have been able to, very fortunately, recently reinvigorate, thanks to our colleague Caroline Gomez-Tom, who is our enrollment network and accessibility manager. If you're interested in these, you can reach out to her. And then there are actually individual contacts for the enrollment networks, but I'd really just like to highlight MCAN, the Milwaukee Enrollment Network, the contact there being Justin Rivas, who, again, many of you may or may not be familiar with, but MCAN does incredible work with the Milwaukee Healthcare Partnership. We collaborate with them every single day, I feel like, and we are able to get a lot of really good information out there, give feedback to the state based on trends we're seeing. I'm sure that a lot of people on this meeting, this webinar, have a lot of really valuable perspective from the different consumers that they work with, the different public programs that they work with. And I think many, if not all of you, would make incredible participants in your local enrollment network if you aren't already. So definitely consider that. And then for finding an enrollment assister, maybe if you take away nothing else, if you are somebody who works with consumers and you want to point them to us, covering wi.org/enroll, or the Spanish version, Enroll Spanish, you can sign someone up with a navigator for a navigator appointment with myself, with Cheryl, with any of our many colleagues who do this work really, really well. You can go on our website and actually access the navigator schedules right there to sign somebody up for an appointment or direct them to do so. You can call us. You can call us directly. There's our main office number, our Milwaukee number, 211 will get a hold of us. We are very, very present, and we like to be accessible to consumers to as great a degree as possible. We also have a web chat option, which is fairly new in the last 2 years, but is getting more sophisticated all the time. But basically, you can go right to our website, and this box pops up, this one that you see on the right-hand side of your screen, and you'll speak live with the navigator. So if somebody just has some pretty basic questions, or actually if they have detailed case questions they want to ask, they can chat with a navigator in real time. We'll give them good information. Sometimes that's all the consumer needs to say, okay, I think I got this. I can go ahead and enroll on my own. I got my question answered. Sometimes it just leads to a navigator appointment, and someone goes, okay, I'm getting this, but I think I need some additional assistance. I'd like to schedule a navigator appointment. It is a great resource. Especially we find that younger folks and people who are a little bit more tech savvy really appreciate having this option. And it also, there is a automated part that is just a tool that is like, I'm looking to see what I might be eligible for, not unlike that tool I showed you guys a little bit ago. And that works really well as well in English and in Spanish. All right, so yeah, that is a lot of information. I will say that we will be doing a deeper dive into the Unwinding, covering Wisconsin, and really any other timely topics that are coming up in, oh, excuse me, a few weeks here for everybody, and we will record that as well. But we are now at the Q&A portion, and I can just look and see if there are any questions. I'm not seeing any through the Q&A. We do have an opportunity right now if people, I think, can still unmute themselves if they want to ask a question. Yeah, otherwise, no, thank you all for joining us, and we really appreciate everybody's time and your interfacing with the community members in Milwaukee to get this word out, to protect them from scams and bad actors, and to make sure that everybody has this information about the Unwinding, because it is unprecedented. Looks like people are. Melissa wants to unmute. I will make sure that happens. Let me see if I can just tweak the settings real quick. I'm gonna stop sharing. We're gonna keep recording, and yes, the PowerPoint will be shared. We'll share the PowerPoint, and I will also put an evaluation link here into the chat, and we'll send a separate email with that as well, so people can evaluate this training and also inform us about what you'd like to see in the future. So I'm gonna see if I can adjust the settings. I'd love for people to be able to come off mute. Let's see here. Anna, are you able to come off mute?
Yeah, actually it did.
Okay, good. Okay.
So my question is this is all really great information, but how are we servicing some of the elderly? Because I'm finding that, I mean, working in Milwaukee County, and once in a while we get elderly and people that are disabled. They're not understanding the process, or they don't know how to use the system, or don't know how to navigate anything through, phones or whatever. Is there any special line that we can send them to, or so if they get a direct person? Because they're the ones that are really struggling.
Sure. I can take this, or Cheryl, did you come off mute? Did you want to take this one?
Yes, Anna, thanks. That's a very good question. And we are addressing that service to the elderly. We meet them in person. And if the preference is that they do everything over the phone, we're handling everything on the phone with them, spending as much time as needed to answer all their questions. But we do meet in person if that person just needs that face-to-face contact. So we're very accessible, very present. And when they call in to Covering Wisconsin, they're going to get someone straight away. So there's not going to be that hold time. So we have locally here, so you guys know, there are 6 navigators here in the city of Milwaukee that can help folks in both Spanish and in English, as well as Hmong, if you have some clients that are Hmong. So we're here to help the elderly get through this process as easily and as less frustratingly as possible.
And I would just add to that, so the Aging and Disability Resource Centers we mentioned, so you might find people who are ready to transition to Medicare, who might be a little bit older, might qualify for Medicare, where we, might not be the last stop for them. We will definitely direct them to the right resource at the ADRC. And I believe in Milwaukee, they have elderly benefits specialists and disability benefits specialists divided into 2 different kind of camps, but we will get them to the right person. And yeah, there are definitely enough resources and experts out there to help those folks. And I think there's a nice addendum question in the Q&A here about people who are housebound. We do, telephonic appointments since the start of the pandemic, people have really, really been leaning into and wanting phone appointments, which we are happy to do. We do that for people all the time. If somebody, it's not unheard of for us to do maybe an in-person appointment. Somebody who has, I personally have done a house appointment for somebody who has agoraphobia and can't leave their home. Like we will meet the consumers wherever we need to meet them. So like I can say that if somebody is housebound and we have that situation, we will do what we need to do to help them.
Exactly. Also, someone asked about the number to contact in the chat. And I noticed that everyone's not able to come off of chat, but that number is 414-400-9489 for Milwaukee. And I'll put that in the chat as well.
Right. And I just disable mute participants upon entry. I don't know if that's not very well worded, if that's the option to allow people to unmute, but can someone like Anna, can you try to unmute and see if that worked? No? Then apparently if I can do it directly, I can ask people to unmute directly like that. Yeah.
Can you give me the number again? And real quick, for example, I had a client that she got in through a special program. It was through Wing Victory, because that's one of the programs that we offer when they come in through crisis. Now they're locked in with them for 1 year. So now when the 1 year's up, they don't have somewhere where I can send them unless they're in our program, and they're only with us for, anywhere from 2-3 days to 6 months. So is there another way I can send this person, because the person has some disabilities and she's Spanish speaking, and I need a direct number where I can send her, because she keeps calling me and she's no longer my client. Not that I want to not help her, but we all have a huge client list load that we're working with, and I can't go back and help her out, and she keeps calling, and I really feel bad, and I keep trying to navigate her somewhere. I'm giving her all these numbers and I don't know where to start for her, because
Yes,
she's that special income guideline, something like that.
Go ahead, Cheryl.
Yes, Anna, you can send her directly to Cover in Wisconsin and she'll get a Spanish speaking navigator. That number, I did put it in the post, but again, it's 414-400-9489.
Now they can work with the program she was in to get that insurance, right? They'll see that.
Well, yes, as soon as she contacts someone and we can do the assessment of her and get all that information, we'll be able to help her with whomever she was working with before.
Oh, great. Thank you.
And Melissa, I see your question. I'm going to kind of let us speak to that together. So the next training opportunity is in just a few weeks here. Thank you for pointing out the date for folks. We will go into more depth and detail on anything that we've covered here. We can do more on coverage types. We could do more on unwinding. We can go into detail on specific populations. Cover Wisconsin, it's not apparent, we're incredibly flexible and we tailor our content to our audience. So I will say one of the best ways to inform that training and make sure that we're delivering what you guys want and find most valuable is going to be to do the evaluation, which I will drop the link into the chat right now, and we will also send a separate email with the evaluation link too. And there will be some opportunities on that to say, hey, this is really interesting. I would like more detail on this, or is this something you can cover? Melissa, is that kind of what you were getting at? Is there anything else you'd like to refer to specifically?
Yeah, that's great. Yeah, my understanding was this was more of an overview, and that one will be a bit more for like hands-on people who provide direct services to clients to get into nitty-gritty details. But we covered a lot of good ground here as well. And yeah, Amos and I just partner on the Medicaid re-enrollment ARPA project. So this is all ARPA funded. And thanks so much to Adam and Cheryl for the training.
Yep, thank you.
Thank you.
All right, so that's good. Any other questions? Again, I dropped the evaluation link. Please go ahead and do that. It's really important for us. It's really important for our colleagues in Milwaukee to have that information on what was valuable and how to make the next one better and more detailed. Really, really interested in you guys' feedback. Is it possible to include some of the resources in the closure letters from Miles to participants? We can, yeah, that would be a great one to include on the next training. We often, I'm always asking the state for copies of their letters. I mean, I see them from consumers, but I am always saying, hey, can you give me the letter language? Because I want to know what consumers bring me, because I'm sure that you guys meet with people as well where they just bring in their mail and they say, hey, can you please explain this to me? And it really helps be armed with that information ahead of time. So yes, I would love to cover that in more detail for you all in the next one. All right. Any other questions? Anything else we can help with while we've got you this morning?
I don't see anything, Adam.
All right, I don't either. And I see, will everyone get the invite for the next one? Yes, of course. We will make sure that that gets out to everybody. Or Melissa and Amos, you'll help us get it to the people who need to get it, of course. And then, of course, we can send everything to, I believe, pretty easily to the participants of this one, which is how we'll distribute the PowerPoint slides and everything as well for you all. All right. Well, that said, thank you all so much for participating this morning. We're really, really grateful for your time, and I hope this was helpful.
Thank you, everybody.
Thanks, folks.
Have a great rest of your day.
Yep. Take care, everybody.